Now, this year, COVID-19 took over the health focus around the world, and Deputy President David Mabuza, earlier delivering the keynote address at the World AIDS Day commemoration in Soweto, he says young women are most vulnerable to HIV and AIDS, and that gender-based violence plays a huge role in that. Kaya Khumalo is following this story for us. He joins us live. So obviously, Kaya, the impact of COVID-19 has affected our fight against HIV/AIDS. Question is, how are we planning to get back on track?
Well, undoubtedly, Shahan, that has been a main challenge in 2020. So a short while ago, the Deputy President, Mabuza, alluded to the fact that we do need a very integrated approach to try. So whenever you go out to screen people, for example, for COVID-19, so now it's high time that the healthcare workers consider the option also to look at, checking people for HIV and AIDS. But also we know that when you look at South Africa's journey from the early 2000s, where we saw denialism really as a dominant issue, to now 2020, where a number of programs really have been adopted to try and tackle this pandemic. And this is what the Deputy President had to say.
We have listened to your input and are committed to supporting you going forward. As partners in the response to HIV and TB, we must respond to the health needs of our adolescent girls and young women. In the same vein, we must intensify the She Conquers campaign for adolescent girls and young women. With this campaign, we seek to decrease new infections in girls and young women. We seek to decrease teenage pregnancies. We want to keep our young girls at school. We want to decrease incidences of gender-based violence and increase economic opportunities for young people, especially adolescent girls and young women.
So, Kaya, what's the Deputy President saying about reaching our targets?
Well, certainly, because we do have a litany of programs that we have adopted as a country, whether you look at the National Strategic Plan, whether you look at the universally supported 90-90-90 target. So to some degree, South Africa has made progress, but there are some areas when it comes to now the people who are receiving treatment. As much as we do have a massive program in the globe when it comes to the provision of the ARVs, but you do know in light of COVID-19, there are some provinces that have seen a bit of setbacks given the fact that you have seen the disruption in terms of the provision and the supplies in some healthcare facilities. You know, most of the activists here were calling on the states really to try and prioritize to avoid the very unintended consequences. But the Deputy President is quite adamant that South Africa will continue to forge ahead and really just work with so many partners that have supported the country. And this is how he explained it.
We have ensured that 73% of people diagnosed with HIV receive sustained treatment. Therefore, the country has a treatment gap of 17%. Those are the people that have tested, they've started treatment, and along the way, they abandoned the treatment. We are encouraged that our country's performance to reach a 90% viral suppression level now stands at 88%. That means we are at 92% in terms of our people that have tested. We are at 73% of our people that have tested and are taking treatment. And we're at 88% of those people who are taking treatment, we have got their viral load suppressed.
Khayelihle Khumalo will leave it right there. He's in Soweto.